No more UTI. Urinary tract infection, commonly known as urethritis, is an inflammation of the urethra caused by bacteria in the urethra. The normal urethra is sterile, but after bacteria enter the urethra, it will cause inflammation of the urethra. Bacteria can run from the urethral opening to the bladder, and sometimes can go up to the kidneys, causing nephrotic nephritis. In addition to entering the urethra from the urethral opening, bacteria can also run into the urethra through the blood. After bacteria cause urethritis, bacteria often remain in the kidneys or urethral stones or in the prostate, and continue to grow in these organs, causing chronic urethritis. Cause. Most infections are caused by E. coli, a type of bacteria that often resides in the large intestine. Symptoms. Frequent urination, but only a small amount of urine can be discharged each time. Feeling red, painful, and burning when urinating, cloudy urine, or even bloody. Lower abdominal distension and pain near the pubic area indicates bladder infection. Fever, back pain, stuffiness, and vomiting indicate that the kidneys may be infected. 1. Women are more likely to suffer from urinary tract infections than men, mainly due to differences in physiological structures. Urethra length: men's urethra is about 15 centimeters long, while women's urethra is only 5 centimeters, so bacteria can easily go straight to the bladder and then flow back up to the kidneys. 2. Sexual stimulation. The entry of the penis not only stimulates the sexual organs, but also sends bacteria from the vulva into the woman's urethra. 3. Urethra opening. The male urethra opening is at the front of the penis, while the female urethra opening is at the vulva, adjacent to the vaginal opening, close to the anus, and surrounded by the labia majora and minora. If the vulva is not clean or is wiped from the anus to the front after going to the toilet, it is easy to be invaded by bacteria in the vulva, vagina or anus and cause infection. Particularly susceptible to infection. 1. Pregnancy. The swollen uterus presses on the bladder, making it unable to completely empty the urine. 2. Menopause. Weakened resistance. The following patients are more likely to get urinary tract infections: women, older people, diabetic patients, patients with urethral stones or prostatic hypertrophy. Patients need to use a catheter. Patients should drink plenty of boiled water, because sufficient urine volume helps flush bacteria out of the urethra. If you have diabetes or urethral stones, you should receive appropriate treatment to prevent urinary tract infections. Prevention methods. Maintain personal hygiene, wipe from the vulva to the anus after going to the toilet, pay attention to sexual hygiene and empty your bladder afterward, avoid using soaps, lotions, and vaginal washes containing perfumes, avoid wearing tight or non-breathable pants including underwear, drink plenty of water, avoid the habit of holding urine, be alert, detect and treat early.